I'm Dr. David Hill, and today we're going to talk about newborn colic remedies. Well, first of all, let's talk about when colic starts, because a newborn starts at birth, but not everybody gets born at the same time compared to the gestational age. That's the age from the time of the last menstrual period. Typically, we talk about newborns being born at 40 weeks gestation. At 40 weeks, colic tends not to occur. It tends to occur at 42 weeks of gestational age at the earliest. If you have a premature baby, you want to count forward to when they were supposed to be born and then tack on a couple of weeks. So if you have a baby who hasn't made it to 42 weeks of gestation yet and they have inconsolable crying, I would be hesitant to call that colic without a really good exam to look for other causes of crying. Now, colic does tend to show up starting at about 2 weeks of age at the earliest. It peaks at 6 weeks of age, and then it tends to taper off, so that by 3 months, very, very few babies still have significant colicky symptoms. We define colic as periods of inconsolable crying that occur for at least 3 hours a day, at least 3 times a week. This crying tends to be just miserable sounding. The baby's probably drawing his or her knees up. They certainly seem to be having abdominal pain. Nobody knows if they really are or not, but that's certainly what it looks like. There's rarely a lot that you can do to make the crying better, and this drives parents crazy. It's actually a big contributor to child abuse, especially in the infant period. So treating colic is important at least as much for the parent as it is for the baby. Everybody's healthier. The problem is then, what do we do to treat colic? We don't have any surefire colic remedies. Anybody who tells you they have a 100% effective surefire colic remedy is lying. They are selling you something. Don't buy it. Nobody's got that. We do have some things, however, that seem to help. So, what's the first thing that helps? Well, it's probably a little late now, but if you had a vaginal delivery, you may be able to protect the baby from colic with some of the bacteria that the baby will absorb going through the vaginal canal at the time of delivery. So if you're talking to your OB about a birth plan, you might let them know, hey, I'm really interested in delivering vaginally if at all possible. Can we do that? Second of all, if you're nursing, again, you may be giving the baby some really good bacteria, some probiotics we talk about, that may protect your baby from growing colicky. Now, once your baby gets the colic, I think about the guy who's looking for his wallet under the street lamp, and the other guy comes along and says, hey, what are you doing looking for your wallet? Where'd you lose it? I lost it over there. Well, why are you looking here? That's where the light is. That's how we are with colic treatment. We're looking where the light is. What can we do? We can change what goes into the baby, at least for a formula-fed baby. Even for a breastfed baby, we can say, well, maybe it's a protein allergy. Mom, why don't you stop drinking milk? Why don't you stop soy products? Why don't you stop eating wheat-based products? And we'll see what happens, see if it gets better. Or if your baby's on formula, we say, well, let's go from this formula to one that's better for colicky babies. Maybe it's an allergy. We'll try a few different things. It works, but it doesn't work often, about 3 to 5% of the time, which is a pretty miserable rate for being effective. We also try treating reflux. Now, since all babies reflux to some extent, we can usually sell ourselves reflux. We can put them on ranitidine, or we can put them on Prevacid, which is lansoprazole. We can thicken their feeds, and if we do it long enough, they outgrow their colic anyway. Again, maybe 3 to 5% of babies respond to this intervention. Now, one doctor has written a book called The Happiest Baby on the Block. And in that book, he suggests a colic remedy with 5 S's. You swaddle your baby with the arms right to the side. You give him something to suck on, preferably a finger, or in a baby with really well-established nursing, a pacifier. You lie them on their front or on their side. Now, you never want them to sleep on their front or their side. That causes sudden infant death syndrome. But while they're awake, you shush in their ear and you gently shake them. I've seen it work sometimes, but I don't know that there are any great studies to prove that it's the end-all and be-all. There are plenty of supplements out there that have been looked at. There's all sorts of recipes for what's called gripe water, which will have a lot of different herbal elements in it. The one element of gripe water that has actually gotten some data behind it is chamomile tea. A little bit of chamomile tea does have some impact on colic, at least in some studies. So you never want a baby drinking a whole lot of fluid that doesn't have calories in it. That's why we have formula and breast milk. Your baby doesn't need water, so your baby doesn't need chamomile chamomile tea, but just a little bit of it, maybe 5 or 10 milliliters or half an ounce, probably isn't going to hurt anything, and you can certainly try that. The thing to remember is your baby is going to outgrow the colic. In the meantime, if there's nothing you can do to stop the crying, take care of yourself. It's okay to put that baby down for a minute and get a quick hot shower, have a cup of tea, watch a few minutes of your favorite TV program, calm down, hand the baby to somebody else for a minute and get yourself back under control, because colicky crying will drive you crazy. Talking about how to treat colicky crying in your newborn, I'm Dr. David Hill.